Hello, everybody, and welcome to the Bright Founders Talk at Temi. Temi is an international software development company that designs, builds, and delivers software for sustainable businesses and promising startups. My name's Matthew, and I'm joined today by Mr. Stephen Collens, who is the CEO at a company called Matter. How are you today, Stephen?
I'm doing great. Glad to be here. Thanks for having me.
Fantastic, Stevens. Now, before we get started, if you don't mind, can you tell our viewers and our listeners a little bit about Matter, what it is, and where it came from?
Absolutely. So we started Matter, opened in 2015 with a mission to accelerate the pace of change of healthcare. So what we do is focus on helping healthcare innovators to go faster and go farther and go more effectively towards their ambitions of improving health and the business of healthcare. So we run an incubator for healthcare startups. We have incubated about 850 companies since we started. They're located all over the world. They use different kinds of technologies, and they are all working to improve health and healthcare, and they operate at different stages. So some of them are just getting started, 1 or 2 people, and some of them have 50 or 100 people, and they're scaling up, and we have different services for them for every stage of development. And then we also work with large companies, big insurance companies, big health systems, life sciences companies, technology companies, associations, and we help them innovate more effectively. So we will help them find and create value from the world of entrepreneurs that exists outside of their walls. We will help to empower their internal innovators to be more effective. We will help them build collaborations across the industry, gain insights into how to think about emerging technologies and where to deploy their resources, all in service of our mission of accelerating the pace of change of healthcare.
Wow, that's incredible. So there's some big numbers in there, and it sounds like starting out, like there's a lot of moving parts. Can you tell us a little bit how Matter came about? Where was it born?
Well, we started with this premise that collaboration is the best way to innovate in healthcare, that the problems that need to be solved, of which there are almost an unlimited number, are such that the only way to really address them is through collaboration. So if you're an entrepreneur and you want to build a company that can really change healthcare in some way, the more that you can connect with the industry, the established companies in the industry from the very beginning, the more that they can be part of your journey, the better, in terms of helping to figure out what are the right problems to solve, not just from the point of view of what can improve health, but from the point of view of what can become a successful business that can improve health. That the more you can connect early on with the industry, the more you're going to focus in on identifying the right problems, building a solution that can be ingested and adopted and used widely by the healthcare system. And on the flip side of that, if you're a big company, almost by definition, big companies don't innovate as fast as the pace of emerging technologies, and there's a lag in their ability to harness these emerging technologies to improve health and achieve their goals. So the more that we can foster these collaborations between entrepreneurs who can work very well on the cutting edge, take certain kinds of risks that are difficult for big companies, iterate rapidly in response to market feedback, and pair them with the expertise and scale and knowledge of the industry, the better able we're going to be to deliver on our mission. And so we sort of backed into our structure and backed into our business model and the things that we do with those sorts of core theses in mind.
Okay, interesting. Now, one of the things that struck me about that right off the bat was collaboration. Now, we know that it's hard enough to get people to work together under normal circumstances. But when it comes to something like this, what were some of the challenges about getting people to sign on, to get stuck in, to start sharing and collaborating with each other?
So we work with a lot of big companies, big pharma companies, big health systems, big insurance companies. And what we found is that most of them have a recognition that there are really smart people outside of their companies that are innovating in spaces and developing things and have knowledge and expertise that could be valuable for them. And most of them don't really know the best way to find the right entrepreneurs to collaborate. And more importantly, either don't know how or just don't have the bandwidth in the process to figure out the right ways to collaborate with these external parties. So that's where we come in. We help find the right entrepreneurs, and then we build the right structures, build the right ways for them to collaborate, to actually result in sort of these useful collaborations that can accelerate change in healthcare. And then from the entrepreneur's perspective, most entrepreneurs will do just about anything in order to help their company succeed. And, it's just a never-ending array of challenges and problems and questions and things that they have to figure out with not a lot of resources and small teams and sort of new situations. Most of the time, almost all of the time, entrepreneurs are very happy to collaborate, learn, work with others, and in particular, at least in healthcare, which is where we operate, they recognize that the more access, the more collaborations they can build with others in the industry and with the established companies in the industry, the more successful they're likely to be.
And is this something that you've always wanted to do? I know you've been with Matter for, I think it's almost 10 years now. Is this something that you've aspired towards? Did you have a dream to do something like this? How did you get involved with Matter yourself?
Yeah. So no is the answer to that. So after business, I went to business school. After business school, I was working at Abbott Labs. That was my introduction to healthcare. Big, large pharmaceutical and medical products company. Had, I think, 6 different roles there over 10 years in the U.S. and around the world. And the large corporate environment wasn't the best fit for me. And so I went and joined an investment firm, which was really my immersion into the entrepreneurial world. It was an organization called Pritzker Group, 2 members of the Pritzker family that had pooled their assets, about $8 billion, and they'd had a venture firm and a private equity firm and a fund of funds, and there's a foundation there. And I worked across those entities, got very involved with the venture firm, and built an incubator at their behest. They wanted a tech incubator to exist in Chicago because it didn't exist. It wasn't the world that I was coming from, which in some ways was an advantage because they didn't come with these sort of preconceived notions. But I didn't know how it worked, and so I spent a long time just immersing myself and listening and getting to know everybody I could possibly get to know in the space, and finding people who did know this space and the entrepreneurial journey inside and out, and learned from them and absorbed it, and then started this tech incubator that was intentionally not focused on healthcare. But wow, did I have fun. I mean, I would wake up on like a Saturday morning and be like, oh my God, I get to work today. This is amazing. And it was just such an exciting, engaging, challenging, new thing to create this incubator, and stood it up. My job was to create it, figure out, what the model was going to be, where it was going to be, what it was going to do, how to staff it, how to finance it, just put the pieces together, and then get out. because they didn't want to run it. They just wanted it to exist. And so my job was to create it, put it on a path, and then sort of extract, and did that. And then actually through the mayor of Chicago at the time, there was an effort to create something sort of similar in healthcare. And at that point, I was sort of like a resident expert on incubators because I'd built one, and there just weren't a lot of those in Chicago. And so became, was working very closely with a group of people on this concept of what ultimately became Matter and what it is that we could really do specifically in healthcare, which is different than just general tech in many, many ways. And then at a certain point, decided to leave my quite comfortable role and focus on this full time. So I left, sort of cut the cord about 6 months before we opened. I'd really probably been working on it almost full time for the 6 months before that. But about 6 months before we opened, left, was, squatting in somebody else's office and trying to put a team together and get the capital we needed to get the thing off the ground. So it combined a lot of things that I really liked. I really liked healthcare. Really, loved working with entrepreneurs, working with investors. Loved building. I loved building the other incubator. I loved building this one and sort of creating it and envisioning it. And did not necessarily think I would still be doing this, 8 years later, but I love it. And so here I am.
That is fantastic. So not entirely by accident, but it sounds like, what would you call it? A happy accident. You were asked to do this and it became something that you were good at. You learned a lot about it. And now you've carried your knowledge over into this new section, and it's going well for you. Something interesting that you mentioned there, you left you said quite a comfortable position to start this up. What was that like for you, going, okay, I'm okay here, I'm doing well, I've got what I need, I'm going to shelve this and I'm going to go out and start a business? Was it a tough decision? Did you have confidence in yourself? What was going through your mind?
Yeah, it was just terrifying. Yeah, I mean, it was terrifying. I lost a lot of sleep. It was very stressful. I'd never done anything like that. I'd always worked for organizations and people and institutions and structure. I worked for a senator. I worked in the U.S. Senate for 5 or 6 years after college. Then I went to business school. In business school, I interned at my summer job was at Goldman Sachs. Then I went to Abbott, this huge, multinational corporation. Then I went to this investment firm. And then, here I was trying to figure out, like, do I pay the few people we have this month, or do we pay our vendors that we've worked with? And like, how are we going to put this thing together and it was a very scary. And no, I did not, I have not been sort of blessed with the kind of limitless self-confidence that others have. So I spent a lot of time doubting my decisions. And is this really, like, holy cow, did I make the right call here? But at the same time, just super energizing and exciting and fun and challenging. And so, there's two sides to that coin.
Nice. So terrifying experience. I think a lot of people will be glad to hear that. Sometimes when you see these things, we always assume that it was easy and that people just kind of fell into the right place or the right role. So to hear about that, it's good for us. And so now you've taken the leap, you're in it, you're committed, you're finding out that you've got things to do. You've got people to pay, you've got vendors, you've got people working for you, there's bills to pay, and you're building on from here. Let me ask you this, what sort of things did you realize really quickly on about maybe yourself or about this journey that you would think are important lessons now?
Some of the lessons that I learned at various points. I mean, one of the lessons I learned early on in my career was that when I was working in the Senate, it was sort of like if something is stalled and something isn't working or isn't going as fast as I think it should be, or is just try something else. And I mean, it sounds kind of trite, but it was one of the reasons why I sort of, despite the fact that I was at Abbott for 10 years and did a lot of different things there and learned an enormous amount, there was always something that kind of grated a little bit with me. And it's just big companies don't work that way necessarily. And you just, that ability to just like try something, throw it at a wall, see what sticks, like whatever analogy you want to use of just trying new things and learning very rapidly from what, from those experiences is really how we approached building Matter from the beginning. The other thing that I did through both incubators was just an enormous amount of listening and just trying to, really understand ultimately who would be our customers, but who all of the stakeholders and all of the people in the ecosystem and different kinds of entities and just spend a lot of time listening and absorbing and synthesizing and really trying to understand what is the journey that these individuals ultimately are on, regardless of where they are in the ecosystem. If they're in huge companies, if they're in universities, if they're students, if they're entrepreneurs, if they're working for entrepreneurs, but they wouldn't necessarily consider themselves entrepreneurs, if they're investors, like what's the journey they're on? What do they care about? What are their challenges? And that was key part to why we were able to build something that that's still here 8 years later.
A few more for you, if you don't mind. Tell us a little bit about the people around you, putting the right team together, trusting other people, just the relationships that maybe you've developed over the last 8 years and what they mean to you and to your company.
Actually, that relates to another lesson I learned maybe, 6-12 months in, probably a year in to the journey that, the first people we worked with, it was a very small group. We worked together all the time and we just sort of, I didn't think about culture and values and it would just sort of happened organically. And then we started hiring more people. Yeah, it's a small organization. Today we only have about 25 people. So, it's not a big company. But once we got beyond the sort of founders and the first little ring of employees who were with us all the time and started to get people who were a little bit more distanced from that or a little bit, more as the organization started to expand, our culture was awful. And I was like, what is going on here? I how come people are acting this way and what's going on here? When I was at Abbott, my view on corporate values and things like that was really, there was some set of values. It had absolutely no relationship to anything in my life. There was no connection between those sort of milquetoast values and day to day or how people interacted with each other. It was like, so my attitude was like, this stuff's kind of useless. Why do we need to create these sorts of things? And then I kind of realized it was in this mess, the culture wasn't really great. And it didn't have a clear way of explaining to people what I expect and how I want people to relate to each other, relate to our clients, relate to, the world and especially to each other. So we created values. We have 5 values. Now we have a very clear mission. And so I hire against those values. And then, the performance management system that we use relies heavily on those values, and those are critical. And so, I think we have a really positive culture now. There's certain things that I always look for. There's certain kinds of things that, that if I see, I rule people out because they may be great, but they're just not the right fit for this culture. And I really prioritize culture now. And one of the things that I sort of knew intellectually, maybe from business school, but didn't really know in practice, was just how easy it is to have a totally screwed up culture. It doesn't take much to mess it up. And so it's a constant.
Thanks for sharing that with us. I think that's very important. And it's nice to hear that something that you didn't quite understand beforehand, once it started to malfunction and you went, okay, you started pulling these things in, you fixed it, and then you realize how important it actually was. So quite a 180 there, which I think is brilliant. Tell me, Stephen, last one for you today. What about the future? How do you plan and project or future-proof your organization? How do you stay ahead of the game and make sure that you guys are in the right place in the coming years?
I think our biggest challenges, and we have a team now that is terrific. The leadership team's been together now for a number of years, and we're always trying to evaluate: are we doing the right things? If we are doing the right things, are we doing them in the best possible way that's differentiated from other offerings in the market? Are we doing too many things where we're being diluted and stretched too thin? And are the things that we're doing going to be the same things we're doing 3 years from now? And if not, what are the bets we want to make? What are the things we want to test? What are the experiments we want to run? One of our core values is never stop experimenting. And so what are the experiments that we can run to see what response we get from the market, what value we're able to create, and which things to really double down on and kind of build out. And we have a nice set of offerings right now that has good product market fit for today. Aren't under any illusion that those are going to be the same things that in several years from now are going to be as relevant.
Absolutely. So staying ahead of the game, always a big challenge, staying current. Stephen, and then lastly, is there anything you'd like to say to our viewers and our listeners if they'd like to get hold of you, if they'd like to learn a bit more about Matter and how it works and maybe how it could benefit them?
Absolutely. I'd say for anybody who's innovating in healthcare, we'd love to get to know you, whether you're just thinking about starting a company or on the very early stages of that, or trying to figure out where to focus, or whether you're working for big, large companies and doing great work. We work across the whole ecosystem of people who want to better harness innovation to improve health. Our website is matter.health. My email is stephen@matter.health. Happy to engage with anybody and see if we can help them on their journeys.
Fantastic, Stephen. Thank you so much for your time today, for sharing your insights and your journey with us. We'll be keeping our eye on you and wishing you all the best.
Thank you so much. It was great to chat with you.